Hi, everyone, and welcome to World Doc Allen podcast. I'm excited to welcome to the program, World Doc Allen. Lindeman. Doc, what's up? What's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. Today's topic, preeclampsia. What is preeclampsia?
Well, the definition or the diagnosis includes high blood pressure, more protein in the urine than usual, and reflexes that are stronger than they usually are, quicker.
Okay, great. What does preeclampsia, why does preeclampsia happen?
Well, this is an old question, and there are not a lot of really good answers, but there is a new answer now that explains that the placenta does not attach deeply enough into the uterus. So it has to pass through the lining, and then it has to make blood vessels into the muscle of the uterus, and those are called spiral arteries. So this is really felt to be a problem with the development of spiral arteries.
Okay, fantastic. What are the risks of developing preeclampsia?
Well, there are people who are at risk for preeclampsia. They include people with high blood pressure, with high blood sugar, preeclampsia in a previous pregnancy, and kidney disease, autoimmune disease like lupus, and of course the most common one is the first baby. And some people think that pregnancies with baby boys are more likely to occur with preeclampsia than with baby girls.
What are some symptoms of preeclampsia?
Well, in the early parts of preeclampsia, there are no symptoms, and that's the problem of getting it diagnosed and treated. But if you really get into trouble with preeclampsia, then you have a headache, you have a visual disturbance, maybe losing vision a little bit, and also, of course, right upper quadrant pain that goes along with stretching the liver capsule.
What are the subtle signs of preeclampsia?
Well, in the beginning, like I said, there aren't really any subtle signs, but certainly the most common early sign is high blood pressure. So that's the canary in the coal mine. It's the beginning of preeclampsia.
What are the treatments for preeclampsia?
Well, the most common treatment, at least that's what I've found, is management of blood pressure. And so send the patient home with a blood pressure cuff and ask her to check her pressure twice a day and to call you if there is any blood pressure reading that's more than 5 points above the usual. For example, if you have a usual pressure of 110/70, then 115/75 would be a reason to call, although certainly it would not be associated with trouble. But that is, if you find it early, you get to make some adjustments. And some of that would mean working less. For example, if you work 3 12-hour shifts, it would be better to work 5 6-hour shifts. And of course, keep an eye on your blood pressure. There's also something called Aldomet. That's an old oral medication for the treatment of high blood pressure in pregnancy, and there are newer ones as well, which are available. And then, of course, the final treatment for preeclampsia is delivery. If you can't do anything else, delivery.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Take care, Doc.
Thanks, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.